We're Fanshawe Dental Hygiene students in third year, and we're here to tell you about proper oral health. My name is Olivia, and I'm going to be teaching about plaque removal.
My name is Stephanie, and I'll be educating you on xerostomia, which is also known as dry mouth.
My name is Erin, and I'll be teaching you a little bit of healthy gums versus unhealthy gums.
My name is Sabrina, and I'm going to talk about denture.
Let's get started.
Good oral health for anyone is important for overall health, well-being, and quality of life. Poor oral health can lead to pain, tooth loss, ill-fitting dentures, and can negatively impact self-esteem and the ability to eat, laugh, or smile. The impact of improper oral health is no different for those with dementia. In fact, studies have shown that rates of poor oral health are greater in individuals with cognitive impairment. Part of good oral health means having healthy gums. Healthy gums can be maintained and achieved with a proper daily oral hygiene regimen. Healthy gums are characterized by a pink color that appears stippled like an orange and is firmly attached to the tooth. Potential benefits of optimal oral health in patients with dementia include reduced tooth loss, early detection of oral cancer, less oral pain, and less intraoral infections, improvements in nutrition, overall health, and appearance. Caregivers play a vital role in the oral health process. As dementia progresses, the person affected may become less able to effectively clean their teeth, understand that their teeth need to be cleaned, express the need for dental treatment, explain dental symptoms, give consent for dental treatments, and take part in decision-making processes about treatment. Dental disease. There are two main types of dental disease, gum disease and tooth decay. Both can cause discomfort or pain and can lead to development of infection. Both pain and infection can worsen the confusion associated with dementia. Gum disease, or periodontitis, can be further broken down into two groups. Gingivitis, which is known as the inflammation of the gums, which can be reversed, and periodontitis, or bone loss, which is irreversible. When proper oral hygiene is not completed on a daily basis, the gums surrounding our teeth become inflamed and not happy. The appearance of unhealthy gums can be seen as red, bleeding, and puffy, all things we can prevent with proper oral hygiene. When we do not treat gum disease, it can progress further into bone loss. If bone loss occurs and becomes severe enough, tooth loss can happen. Tooth decay is caused when the bacteria in our mouth feeds off the sugar from food and drinks we intake during the day. This process produces acid, which then attacks the tooth and causes decay. A healthy diet, good oral hygiene, and the use of a toothpaste or mouth rinse containing fluoride will help prevent tooth decay.
Dental aids. As dementia progresses, the person may lose the ability to clean their teeth or lose interest in doing so, and caregivers may need to take over this task.
Some assistance with daily oral care will be needed in the early and mid stages of the disease. They will require total assistance with care in the advanced stages.
The technique and aids will vary depending on the individual concerned. A wide variety of aids are available to achieve optimal oral health. The Phones technique.
And so basically what Phones method is just large circles around the outside surface of the teeth, all the way around, spending a couple seconds on each area. For the biting surfaces, we need smaller circles to get the bristles into the grooves, top and bottom. And on the inside, down under here, we just need smaller circles to get into those little grooves and hard to reach areas.
Electric toothbrush. As dementia progresses, physical dexterity can decline as well. If a client still has decent manual dexterity, an electric toothbrush can be recommended. A variety of options are available. With an electric toothbrush, the bristles of the brush will do all the work, so there will be no scrubbing required. End-Tough brush.
Where the toothbrush is just too big to get. So this guy fits right in here to get the hard to reach areas along the gum line and underneath the tough muscle of the tongue.
Floss holder.
So if you have someone who has decent manual dexterity, you can use what we call a floss holder. Basically, to put it together is you take a really long piece of floss, tie it once or twice, a few times around this little button. You follow it down the groove, tie it on the ends of the little fork, down the groove on the other side, and retie it on the little button on the back. So Stephanie has a little area here where we can get in. You basically want to seesaw the floss back and forth until it gently snaps below the contact of the teeth. Wrap around one side of the tooth into as much of a C shape as possible. Wrap around the other side of the tooth in as much of a C shape as possible.
Floss picks.
And how it works is it goes in the tiny little open spaces in between her teeth. So if you can kind of see here, it goes right in. It's not as good as the gold standard of flossing. However, it's a good replacement.
Sulca brush.
So as you can see, it's kind of at a great 45-degree angle here to kind of go right in on the back of these teeth where a toothbrush just wouldn't do a good job.
Hand over hand technique. There will be times when the client will require physical assistance with the toothbrush. The caregiver can place their hand over the patient's hand and guide them through proper motions. 2 toothbrush technique. Sometimes when the client is unwilling to open, the caregiver may need to gently loosen the client's bite using the handle of another toothbrush, thus creating better access inside the client's mouth.
Denture care. It is important to look after dentures just as carefully as real teeth. It is important to clean them every day to avoid plaque and tartar buildup. Dentures should be taken out every night. The gums and remaining teeth should be brushed gently with a soft toothbrush. It is important to stimulate the gums to remove bacteria and encourage circulation. It is best to soak dentures overnight in either warm water or a special denture cleaner, such as Polydent. A half and half mixture of water and vinegar can also be used. Soaking will loosen plaque and tartar from the denture and will make it easier to remove debris when brushing. It is important to know that a client's denture will not fit well if gums are sore, swollen, or bleeding. Dentures will fail if remaining gums and teeth are not healthy and in good condition. Be sure to see your dentist regularly for professional cleanings and dental exams so that he or she can detect any early signs of gum disease and provide appropriate treatment. It is also important to watch for changes in fit. If your dentures aren't fitting properly or don't feel right, that's another reason to check in with your dentist. Gums and bone levels in our mouth can change over time, and that will cause the denture to fit poorly. If a denture does not fit properly, they can cause issues such as sores, pain, and burning. It can also cause a client to swallow air. A dentist can often make adjustments to an ill-fitting denture right in their office. It is okay to use products such as Polygrip or another denture adhesive for added retention. It should not be used as a solution for a denture that is too loose. If a denture is too loose after a period of time, a dental visit should be arranged to fix the problem and get bone levels assessed.
Dry mouth. Xerostomia, also known as dry mouth, is caused by a decrease in saliva production. Everyone experiences dry mouth every once in a while. It happens while we are nervous, upset, or under stress. However, if you're experiencing dry mouth every single day, then your mouth is probably trying to tell you something. If you have dry mouth, you're more susceptible to potentially serious oral health conditions. Symptoms may include oral infections, bad breath, trouble tasting, burning sensation, dry or sore throat, cracked lips, tongue, and inside of the mouth, a dry, rough tongue, and mouth sores. What causes dry mouth? Dry mouth is a side effect of taking medications. Dry mouth is listed as a potential side effect for more than 400 medications. The link between Alzheimer's disease and dry mouth comes hand in hand as many affected with dementia are taking multiple medications. When there isn't enough saliva to lubricate the mouth, it becomes hard to speak, chew, and swallow. For some people, this condition may be uncomfortable or seriously irritating. Here's a few strategies to help prevent dry mouth. Use alcohol-free oral rinses. Chew sugarless gum or candies to help stimulate the saliva flow. Sip on water or snack on ice chips often. Avoid alcohol, caffeine, carbonated beverages, and smoking because they dry out the mouth. And avoid acidic, salty, or dry foods. You can purchase products at your local drugstore to help relieve dry mouth symptoms. I would recommend the company Biotin. There are moisturizing relief products, hygiene products, and saliva stimulation products.
Thanks for watching the video. We hope you found it informative. Please answer the following multiple choice questions to test your knowledge.
Thanks!
When is the best time to remove your dentures? A. Every morning. B. At every meal. C. Before bed. Or D. Dentures are to be never taken out. The answer is B. Before bedtime is the best time to remove dentures. Removing dentures for the night allows the tissues to rest and heal. What is a characteristic of unhealthy gums? A. Pink, B. Firm, C. Stippled, or D. Bleeding? D. Bleeding is the correct answer. We want our gums to be pink, firm, and stippled. If our gums are bleeding, that is a sign of gingival inflammation. What aid can you use as an alternative to flossing? A. Sulca brush, B. Floss picks, C. Floss holder, or D. All of the above? The answer is D. Sulca brush, floss picks, and a floss holder can all be used as alternatives to flossing.